What is coronavirus? A coronavirus is a kind of common virus that causes an infection in your nose, sinuses, or upper throat. Most coronaviruses are dangerous. In early 2020, after a December 2019 outbreak in China, the World Health Organization identified SARS-CoV-2 as a new type of coronavirus. The virus has caused a worldwide pandemic and has brought havoc, changing our daily lives and how we operate the economy, the way we learn, the way we communicate, and etc. The coronavirus disease, also known as COVID-19, is a disease caused by the virus SARS-CoV-2 that can trigger what doctors call a respiratory tract infection. It can affect your upper respiratory tract, sinuses, nose and throat, or lower respiratory tract, windpipe and lungs. Like the SARS virus in 2004, it is a virus that is originated from bats and has jumped from one species to another before reaching to humans. It spreads via person-to-person contact. The infections of the coronavirus diseases ranging from mild to severe, with some infection causing death. The outbreak began in Wuhan, China in December 2019. It is thought that the outbreak initially began in an exotic food and seafood market in Wuhan, although this is subject to debate by some. The rate of infection. R0, pronounced R0, is a mathematical term that indicates how contagious an infectious disease is. It's also referred to as the reproduction number. As an infection is transmitted to new people, it reproduces itself. R0s represent the rate of infection of a disease and indicates whether a disease is contagious or not. It applies to a population where it does not previously experience infection and has not yet received a vaccine of a particular disease. If a disease has an R0 of 18, a person who has the disease will transmit it to an average of 18 other people. That replication will continue, assuming no one has been vaccinated against the disease or is already immune to it in a community or population. Measles has one of the highest numbers in R0 with a value of 15 in populations without immunity. It has the ability to cause potential explosive outbreaks. R0 is calculated by using an existing data of an outbreak or infections. R0 cannot be determined the moment a population is infected. Thus, scientists relies on the number of already infected and is calculated by contact tracing. Using data such as the number of people dying, admitted to hospital or testing positive for the virus or bacterial disease, allows to estimate how easily the virus is spreading. What is contact tracing? Contact tracing is a process of identifying a person or a group of people that has been exposed by someone who carries the virus and is potential to infect others, or has already done so unknowingly. This process allows to help in detecting potential spreaders or super spreaders, which can help in reducing and breaking the chain of infections, keeping transmission at bay. Contact tracing can be broken down into 3 basic steps. The first step, contact identification. Once someone is confirmed as infected with the virus, contacts are identified by asking about the person's activity and the activities and roles of the people around them since onset of illness. Contacts can be anyone who has been in contact with an infected person, family members, work colleague, friends, or healthcare providers. Second step, contact listing. All persons considered to have contact with the infected person should be listed as contacts. Efforts should be made to identify every listed contact and to inform them of their contact status, what it means, the action that will follow, and the importance of receiving early care if they develop symptoms. Contacts should also be provided with information about prevention of the disease. In some cases, quarantine or isolation is required for high-risk contacts, either at home or in hospital. And the last step, contact follow-up. Regular follow-up should be conducted with all contacts to monitor for symptoms and test for signs of infection. Lockdown, curfew and quarantine. Since March 2020, when the World Health Organization (WHO) declared coronavirus as pandemic, many countries have implemented lockdown and curfew strategies in order to curb the spread. Many countries have different versions of the curfew or lockdown that was implemented. Known as the Great Lockdown, and has been unprecedented move and is expected to play out in 3 phases. First, as countries enter the lockdown, then as they exit, and finally as they escape the lockdown when there is a medical solution to the pandemic. Many countries are now in the second phase, as they reopen with early signs of recovery but with risk of second waves of infection and reimposition of lockdowns. Surveying the economic landscape, the sheer scale and severity of the global lockdown are striking. Most tragically, this pandemic has already claimed hundreds of thousands of lives worldwide. Furthermore, the resulting economic crisis is unlike anything the world has seen before. Social distancing. Measures of social distancing, such as keeping a 1 meter distance, wearing masks in public, avoiding surface touching, wireless payment, and etc., it has been practiced recently as a way to curb the spread of the disease and to prevent crowds of people that has high potential on creating new clusters of infections. While there are different ways to increase individuals' level of concern and awareness, fear-mongering is not one of them. Fear-based communication strategies only go so far, as they have the tendency to spread miscommunication, skepticism, and misconceptions. Fear can develop quickly depending on how government and media communicate information about the disease. Fear can affect the effectiveness of social distancing and other preventive measures, as well as cause unintended impacts on populations.
What are you waiting for?